It also comes from lack of focus on recovery.
But then the next day, they start to feel that, delayed onset muscle soreness.
If I could ask for one superpower, it was always to look at people working out and me getting the benefits. I think this is as close as it gets.
And especially in India, it's very common for people to be lacking calcium, vitamin D, different electrolytes as well. Hi, welcome back to another episode of The Wellness Blueprint, a podcast by The Wellness Co, where we break down the scientific concepts behind modern day wellness and make it simpler and easy for everyone to understand. Today, I'm joined by Dr. Garima and Dr. Nivedita, two of our senior most experts here at The Wellness Co, to talk about a topic that's been in the mainstream news and in the media spotlight quite a bit recently, which is combining multiple therapies or combo therapies to enhance your well-being and achieve your health goals. So one of the most prominent combination therapies that we've been hearing about a lot from scientists like Dr. Andrew Huberman, from Gary Brecka, who's one of the ultimate biohackers in the world, is contrast therapy. So contrast therapy has been one of the most popular ways for people to improve their well-being and harness the potential of modern day wellness in really sustainable and long-term ways. So maybe Dr. Nivedita, Dr. Garima, you guys can shed a little bit more light on how contrast therapy and some of these combination therapies have really become more and more popular these days.
Okay, so chronic fatigue comes from stress. It also comes from lack of focus on recovery and nutritional gaps. Yeah. So once you do far infrared sauna, it helps you reduce levels of your inflammation and also relaxes your muscles. You do cryotherapy in quick succession and your circulation improves. And also your metabolism gets a boost. Nutrition will make sure that you get the right fuel to sustain your energy day after day. And a layering of these therapies actually improves your cellular energy and stamina markers by 30 to 40%.
Oh, wow.
And top performers have been seen doing these combos for top performance.
Amazing. So you're saying that basically layering these therapies on top of each other and following some sort of regimented health protocol is allowing people to unlock new levels of productivity and recovery that they haven't really been able to reach before.
Exactly.
Let's say someone reaches a plateau in their fitness performance and they're not really able to break past it, or they have an issue with their energy levels and fatigue, or they're feeling burned out. You guys are saying that these are a few of the ways that people can basically start to break past those barriers.
Exactly. Yes. And that's actually happening because it starts working at a very cellular level. So there are two kinds of things that are happening. With the heat therapy, that's the far infrared sauna, you have the heat shock proteins that are being produced, and they're basically responsible for healing things, for finding out the damaged proteins and then repairing them within your system. With the cold exposure, you have the cold shock proteins that are being produced that are responsible for bringing down inflammation. So both of them together are basically harnessing the power that comes with parasympathetic nerve activation and sympathetic nervous system activation to bring you the best benefit.
Right. I myself have seen some great results from contrast therapy. So this is something that I've been doing pretty much once a week. I know that we have a lot of members and people who come to us multiple times a week doing contrast therapy and have noted feeling a lot more rejuvenated and a lot better and able to kind of, feel that whole body reset that we talk about quite a bit, which is when you're really feeling down and you're really feeling like energy levels are crashing or you're having certain kind of health problems. It's a way for you to really kind of get back to your kind of level one, start back as a kind of, fresh mindset and take on whatever challenges you might be having.
Absolutely. So, they feel lighter is what I usually get to hear from them.
Awesome.
Yeah. And sets you up for the day, the more the merrier.
Yeah.
Great. So of course, contrast therapy using our far infrared sauna and our cryotherapy chambers in a sequential manner is just one of the few combination therapies that we offer that's been providing our clients with some great health benefits. One of the most common complaints that we usually see from people is those midday energy slumps, or that they feel like they're not feeling well rested and they feel like that fatigue that Dr. Nivedita was mentioning as well. It's something that's very common. According to some studies, up to 68% of adults are suffering from these repeated midday slumps, which are having a massive drag on their productivity. They don't feel like they're able to work out properly or carry through with their kind of health goals in a sustainable manner. So one of the other therapies that I really wanted to talk about today is EMS training. It's one of our kind of topmost fitness experiences that we provide here at the Wellness Co, in which in a 20 to 30 minute session, you can get the same calorie and fat loss benefits as a 2 to 3 hour gym workout, right? And when we combine that with our whole body cryotherapy, that's something that's been really popular these days. So maybe Dr. Garima, you can speak a little bit about what our clients have been kind of mentioning and what they've been talking about.
Absolutely. So when we're talking in terms of EMS training, as you rightly mentioned, we're working out smart. We're not working out hard. We're not putting hours and hours of energy in this workout routine. The whole idea is to bring about an efficient muscle contraction, which if does not happen in a conventional workout setup, you will realize that the perceived amount of exertion is more in these people. So they feel extremely tired after a workout instead of feeling fresh and rejuvenated. Also, in such cases, it's important to note that their likelihood of getting soreness or even an injury increases by manyfold if they do not work out in the right manner as is suggested. With EMS training, you are also combating these issues by reducing the likelihood of getting sore, by reducing the likelihood of being extremely tired after a workout because you're just working out for 20 to 40 minutes, but you're ensuring a maximum contraction for your muscles. In fact, it goes up to 30% of a normal contraction. Another thing that happens with a normal workout is that if the muscle activation is not proper and you're getting a lot of soreness, or if you're lifting a lot of weights or you're doing an extremely vigorous workout, there's going to be a lot of micro tears in your muscles. Now, these are good, but they are also going to lead to a lot of inflammation in the body. And if the circulation is not appropriate, then this inflammation is only going to be built over a period of time. And this often leads to a lot of absence from workout for a lot of people. With EMS training and cryotherapy in a combination, we combat these issues altogether, because while EMS is working towards an efficient muscle contraction, whole body cryotherapy is ensuring that there's improved circulation, there is going to be reduction in inflammation. All in all, it's going to help your muscles recover. In fact, a very interesting benefit about whole body cryotherapy is that it causes browning of the fat cells. So we have two kinds of fat cells, white and brown. The brown ones are the ones that can actually produce or utilize the energy from the fat reserves. White cells are just storehouses. However, when you have browning of these white cells because of the cold exposure, you can utilize these white cells as an energy source as well, which means that now this person has a better chance of losing fat and performing better in endurance workouts.
Right. I think another very underrated benefit of this combination therapy is the fact that EMS training actually makes you feel really tired the next day. Yeah. And that is something that we see a lot of people reporting back, is that they conduct the session and then they've, worked out for 30 minutes, 40 minutes, whatever it might be with us, but they might not feel super tired right away. Yeah. But then the next day they start to feel that, delayed onset muscle soreness, which is DOMS syndrome, start to happen. That's where another area where whole body cryotherapy really comes in handy. Is I've talked to a lot of people, friends of mine, who have recommended to try EMS training. The first experiences usually go a bit like that, where they experience a lot of soreness. So it's obviously a kind of huge benefit for us to have these two treatment protocols here together, so that we can kind of create the most efficient workout plans as well for people and allow them to train multiple times a week under the EMS training protocol and really supercharge their metabolism and the fat loss benefits and the kind of, muscular strengthening that they're looking for as well.
Exactly. It's very complementary.
EMS training is one of my favorite therapies. And if I could ask for one superpower, it was always to look at people working out and me getting the benefits. I think this is as close as it gets to that one. And no wonder professional athletes routinely layer these for improved performance and muscle recovery.
Yeah, that's true.
Mm-hmm. And then there are clients who may need to address and lose some weight and address their other autoimmune disorders or conditions, or even injury states for that matter. And for that also, I think EMS Pilates would be a better fit. And also to couple it with PEMF, right? To reduce their inflammation and aiding the recovery. What do you say?
Absolutely, I agree with you. Usually with populations that are dealing with hormonal issues or autoimmunity, you'll see that they are constantly in a state of stress. Their cortisol levels are spiked already or are very easily spiked. Mm-hmm. Now, in such cases, you want to work with a program that's mild to moderate intensity, and EMS Pilates just check all the boxes. And additionally, with EMS Pilates, it's more about mind and body coordination. It's neuromuscular control and balance. So it is one of the best workout routines for people such as this. In conjunction with the EMS Pilates, pulse electromagnetic field and negative ion therapy works the best because this focuses on internal healing in terms of how your cells are functioning, literally like a battery. So they're healing better, you're feeling better, and thus you're performing better. So that happens to be the best combination to go with such population.
Absolutely. I think a lot of the common concerns that we have when we see clients with these concerns, with these health issues, is that they tend to have very poor blood circulation overall. This is something which we look to improve significantly because they might be very sedentary, or because of the different health issues that they might have, they don't feel like they can get into a gym or kind of work out outdoors with the different environmental factors that are there as well.
Impact.
Yes. So they need something low impact. They need something which works on a different set of priorities, which of course is helping them tone and strengthen, but not in a way that makes them feel fatigued and burnt out super quickly because they're not able to work out for those extended lengths of time, right? So in an efficient manner, we're able to get them that kind of exercise that they need, that their body needs. And then we, of course, are able to supplement that with something like a PEMF therapy, which I think something which we've brought to India for the very first time and has helped people in their kind of relaxation, in helping them deal with the different stresses, like Dr. Garma mentioned, the cortisol levels that are being spiked, and again, improving that circulation, improving that kind of, blood flow across all the different kind of, perimeters of their body, so that their cells are really kind of getting the oxygen that they need and improving the kind of outcomes that they have with any kind of treatment process that they might be going through as well.
Exactly. Yeah.
So another combination therapy that people have really been kind of raving about, and something which we brought again with the Wellness Co a few years back, and it's always been super popular, is combining our far infrared sauna with the red light therapy. So people who have a lot of concerns around, let's say, skin health and detoxification, and we recommend them to, let's say, get onto a treatment protocol that's going to help them alleviate their skin concerns and improve the, let's say, outcomes of any treatments that they might be following up on from a dermatology point of view as well. So maybe Dr. Nivedita, you could speak a little bit more about that and what we're seeing with these clients.
Okay, so far infrared sauna will detox you. And if your body's detox mechanisms are not working optimally, your skin manifests it. It shows on your skin. So the first step is take out the toxins and then probably give the body the energy it needs to build new stuff. Mm-hmm. So far infrared sauna helps you detox. And red light therapy improves your energy efficiency by repairing your mitochondria. That means that now your body has more energy to do the stuff that it was not doing earlier. For example, collagen. Collagen also shuts down in many states and with age naturally, but it doesn't have to. So red light kind of aids your mitochondria and gives it the boost that it needs to make more collagen. And so your skin improves.
Right. I think that's something which is really key and missing out on when people look at, let's say, what kind of concerns that they might be having with regards to their skin, whether it's pigmentation or breakouts or environmental factors or stress. Everyone wants to look at what they can do at the superficial level, but what we're doing here at the Wellness Co is trying to tweak people's mindset towards what's going on at the cellular level, right? What's going on inside the body that we can work on in conjunction with, of course, we have the kind of best-in-class facial treatments and best medical advice available for what people can do to kind of start to work on a holistic program, a holistic health protocol that helps them actually achieve those goals, because any kind of superficial treatments might even be temporary, right? They might last for 2 months, 3 months, but then the same concerns and those same problems are coming back. What we want is for people to be on a sustained cycle of progress where they are able to kind of eliminate these concerns from their life over a longer term. And that's the goal.
Yes.
Yeah, absolutely. And I think this one also extends into educating them about anti-aging that occurs because of oxidative stress. So usually when you're dealing with red light therapy and far infrared sauna together, your whole intention is to bring down toxicity and also to reduce the amount of oxidative stress that's actually occurring in your cell because of a mitochondrial dysfunction or a mitochondrial fatigue. And both of these things can be easily dealt with when you're working with red light therapy that's helping improve your cell's efficiency and energy production, and far infrared sauna for detoxification.
Absolutely. I think something that people really know about a lot these days, which maybe wasn't so much spoken about even a few years back is collagen, right? Collagen has become such a huge buzzword. People are taking collagen supplements in many, many different forms, whether it's an effervescent tablet or a powder, or it's found in our food as well nowadays. People are really highlighting the benefits of collagen. But of course, oral supplementation and what you can take, let's say, as a dietary intake, that's just one part of it. For a lot of people, especially with age, collagen production, the way it slows down and kind of plateaus and then starts to kind of, decline, you need to implement something like a red light therapy as well that stimulates the natural production of collagen in your body, in your skin, and really affect that kind of change and that progress from all angles.
Collagen, people who are just concerned and then want to have a great skin, it's not just for them, the red light therapy. As we age, collagen is more important and relevant because your blood vessels are made of collagen. Your organs are made of collagen. So the whole foundation that your body and your organs work on is collagen. So you need to be focused on collagen more than just what looks or appears on the outside. It is your overall health. And I think as few as 6 to 8 sessions of red light also remarkably improves or boosts collagen metabolism or buildup in the body, like up to 30%.
Absolutely.
Studies show.
Absolutely. I think that's very key because the red light therapy protocol that we follow with the kind of advanced technologies available with us, it's not just skin deep. It really kind of penetrates to the mitochondrial level, to the cellular level, and it is reaching those organs, right? So when we're talking about our photobiomodulation beds, that is somewhere where you're getting a complete full body exposure from, let's say, hair to toes. Everything is kind of being pumped full of the red light, which is really beneficial for collagen production throughout your body.
And not just those face masks.
Yes, not just the face masks, of course. Yeah. I think another therapy protocol and combination that's really important to highlight this time of year especially is our IV drip therapy and HPOT combo protocol. I think that's something which people would find really relevant during this time because, of course, now entering into the festive season, we're going to see pollution levels rise across different cities. Of course, Delhi and Mumbai have seen the worst of it in the last couple of years, but even Bangalore, Hyderabad, Ahmedabad, etc., are not immune to the kind of adverse effects that the weather brings with it during this time. So maybe Dr. Garima, if you could speak a little bit more about how we are combining together something like IV drip therapy with HPOT to work on not only kind of anti-pollution measures, but also to help people with the different deficiencies and health risks that they face during this time.
So with IV therapy, we're putting in the right kind of ingredients, the micronutrients in your body so that your cells can take them up, heal themselves, function better, and produce the right amount of energy. And with hyperbaric oxygen therapy, you're making more oxygen available for your cells to take up and utilize in order to produce more energy. So both of them go extremely well in a combination wherein the ingredients as well as the fuel for burning them is being provided to your cells.
I think another thing that's really important to note with IV drip therapy is that of course, we're looking to kind of establish a foundation for people, right, to build upon. Now, we need the right building blocks to be there in your body, the right ingredients, the right minerals, the right vitamins, the right kind of, let's say, nutrient profile, so that we can start to work on those health goals. Because at the end of the day, whatever diagnostic tests we're able to kind of do for someone, whether it's our advanced blood tests or genetic tests or oligoscan tests, that's going to reveal some deficiencies or some areas where the body is lacking. And especially in India, it's very common for people to be lacking calcium, vitamin D, different electrolytes as well. So we need to reintroduce those into the body first so that we can start to then build up upon that with something like hyperbaric oxygen therapy and even adding in, let's say, EMS training, depending on their health goals, and work on achieving those things without kind of, promising any kind of miracle cures or anything. Because at the end of the day, like we were mentioning before, if you don't solve for what's going on at the cellular level, these problems or these health concerns are probably going to reappear. And that's not something that we want, right?
Yeah, that's right. And also I want to mention about advanced diagnostics or oligoscan. We were mentioning deficiencies. So now, although many people are deficient, but they usually are in denial because their blood reports say otherwise. They say normal levels. Also, so blood reports and the screening that we do is different, and we'll discuss it when they're there. So it's different, and it gives a whole picture from what you're consuming to what the cells are actually getting. Mm-hmm. So it's good to have blood tests and these tests side by side, which is tissue testing. And also we have now entered the age of personalized medicine. That means that maybe you're not deficient in something, but because of, let's say, more demands on your body, that you're an athlete, you need 100 times more of something than anyone else. So that way we can optimize health for you.
Yes.
Maybe you need 10 times more or 100 times more than the RDAs.
Absolutely. I think that's a very key note to take away from as well, is that when we look at something like our advanced genetic testing as well, it usually reveals what someone's absorption levels or what their sensitivity to certain allergens or certain food products is as well, which can tell you a lot about what certain vitamins and minerals is doing in their body, right? Someone might be very okay with, let's say, somewhere close to the RDA level of protein requirement, but another person might have more wear and tear on their muscles going on because of their kind of, athletic performances or what kind of workout regimen they're following. So they need much more. So building that into our kind of, nutritional profiling is also super important. And I think it helps us a lot with recommending the right nutrients and minerals to add in the IV concoctions as well, and recommending the right IV drip formulation that's going to support the person with whatever their health goals or their daily schedule or their life looks like. Maybe as a kind of final note on this, when we look at, again, the combination of IV drip therapy and hyperbaric oxygen, I know with hyperbaric oxygen nowadays, it's going to be fully booked out and super popular. It's kind of always a kind of predictable trend with us here. Is so anything that you would recommend that people would kind of want to watch out for? And when would they ideally want to start coming in for some kind of sessions like these so that they can avoid those kind of environmental health risks and also work on what's going on inside?
I think it's important to recognize the patterns. So, for example, during this time, we know that the pollution is rising. This is a good time to start preparing yourself, preparing your immunity, your respiratory function, and book a hyperbaric oxygen therapy session. However, for some people, this is also the pollen or the flu season. So, finding the right kind of IV so that their immunity is boosted is equally important for them. So, it's always about identifying patterns throughout the year wherein you feel that something might go wrong or there's something that you really want to prepare yourself for, and then build a wellness routine, because all these combinations are great. They're scientifically backed and they are evidence-based. However, all of these combinations may not be for everybody. It has to be a very personalized approach wherein a person recognizes their concerns and the expert recognizes what all systems or functions are actually affected that need optimization or correction. And based on that, the best kind of combination can be sought out.
So, of course, as Dr. Garma mentioned, a person might come in with a variety of different health concerns or things that they might be worried about that are coming up with regards to seasonality as well, right? Someone might be concerned about the rising pollution levels, but at the same time want to do something to improve their immunity and avoid that kind of, harmful effects of flu season as well.
Yeah, because it's always the interplay between your environment and your immunity. Yeah. So because she mentioned seasonal allergies, that makes me think whenever you're anticipating an allergy season coming in with the change of season, doing whole body cryotherapy just like a month leading up to that, or maybe whenever seasons change, will boost your immunity and will make the intensity of the episodes much lesser. Yeah, so it will help you be more comfortable with what you deal with, especially allergic rhinitis is one.
Awesome.
Yeah. And winters are setting in, and whole body cryotherapy is a brilliant suggestion.
Yes, I think so too, because I think people might not know this because they might think that it's a little counterintuitive because, of course, it's getting colder. So then why do we do kind of cryotherapy? But it's actually really kind of backed in the science. And there's many studies, numerous studies that are out there that show the immunity boosting benefits of cryotherapy, because when you expose yourself to an even colder environment, even if it's for a very brief period of time, you're able to deal with the natural cold around you much better. And it helps kind of prepare your body in a good way that it's, ready and used to kind of, fighting those kind of cold symptoms, those cold shocks. And you're able to, of course, deal with the weather better. And you can, of course, boost your immunity during that time when it kind of crashes and starts to come down.
It releases those anti-inflammatory peptides when you do it.
Yes, absolutely. So I think we've had a great conversation here today discussing some of these amazing combination therapies. I think our viewers would be kind of happy to know that we have some amazing kind of, festive offers and things going on as well. Currently, very exciting things going on at the Wellness Co. So you should book your sessions today and come check out what we've got on offer. And of course, our thank you so much to our incredible doctors here for their valuable insights. And we'll see you guys next time. Thank you.